सेकंड लेवल स्कॅन हा
हा
यालाच पाहिजे, द्यायला पाहिजे रेडिओलॉजिस्टला, असं नाही आहे ना.
राईट सर, हो ना. As well as the consequences. I thank Dr. Rajendra Singh Pardeshi, our AMOGS President, Dr. Dalvi Madam, for giving me this opportunity, as well as I congratulate the PAC committee, Foxy, as well as AMOGS, and I thank Dr. Madan to making my committee also part of this, and I wish success to this CME today. Thank you so much.
Yeah. Thank you, madam.
Please.
Dr. Monica.
So first of all, thank you for associating with Public Awareness Committee, both AMOGS and Foxy. I would like to thank the office bearers of Foxy. This is Dr. Rishikesh Pai sir, Madhuri ma'am, and Alka Pandey madam, our vice president. Dr. Pardeshi sir and Sujata Dardi ma'am, as AMOGS office bearers, have left no stone unturned to mentor young budding chairpersons like me and Dr. Madan. They have been always the guiding force. Thank you so much, all the Foxy committees, both the Violence Against Women and the Foxy Public Awareness Committee, Dr. Priyankur and Dr. Kiranmai ma'am, for joining us with hands for such an innovative program. Together, we can achieve more. This is what Dr. Madan has already proved with collaboration with all the societies. Not taking much of your time, let us now proceed to the program further.
Yes. Thank you, all the four chairpersons. Now we will move on to inauguration. I would like to invite all the guests and all the experts for the inauguration. Yes, we will have virtual inauguration. Yes, I invite Dr. Suyoga ma'am to take over further for proceedings.
Thank you, sir. Thank you for giving me this opportunity to become the co-convener of this unique symposium on sexual abuse. And I think all the topics are very practical and will be very fruitful for all the attendees over here. Sir, few lines for you. मंजिल उनको मिलती है जिनके सपनों में जान होती है, मंजिल उनको मिलती है जिनके सपनों में जान होती है, पंखों से कुछ नहीं होता जनाब, हौसलों में उड़ान होनी चाहिए. And this is for you, sir, and taking this CME further. We have with us esteemed experts, Dr. T.S.S. Rao, sir, Dr. Padmini Prasad, Dr. Kiranmai Devi, Dr. Varsha Lahade, Dr. Gauri Karandikar, Dr. Sudesh Doshi, and Dr. Girish Mane and Dr. Priyankur Roy. We have esteemed faculties with us and they will throw light on the various subjects. Dr. Madan Kamble, sir, Chairperson of AMOGS Aesthetic and Sexual Medicine Committee, and he was the past President of Akluz OBGY Society, member of Foxy Sexual Medicine Committee, and yes, he is a member of the Council of Sex Education and Parenthood International, and he is the chairperson, organizing chairperson of AMOGS Zonal Conference on Sexual Medicine, and he is trained in aesthetic gynecology. I request sir to introduce our faculty.
Can you please, I now take privilege to introduce Dr. T.S. Satyanarayana Rao, sir. He is the immediate past General Secretary of Indian Psychiatric Society. He is also the Editor General of Psychosocial Health, former President Indian Association of Geriatric Health, and former Editor of Indian Journal of Psychiatry. The next slide, please. Dr. Padmini Prasad ma'am, she is the first qualified women sexologist from Karnataka. She is also the medical director of Ramnini Nursing and Maternity Institute of Sexual Medicine, Bangalore. She is the past president of Bangalore OBGYN Society in the year 21-22. She has also received the Best Society Award from Kasoga for the same. She has worked in Foxy at various positions. Oh, the next panelist. The next slide, Dr. Kiranmai ma'am. She is a professor at GMC Vanaparty, College University of Health Sciences. She is the chairperson of Foxy No to Violence Against Women Committee from the current year to 2025. And she is also the core member of Foxy Youth Cell. She is a core member, coordinator, the teacher of trainer of trainers and faculty for Dhira. We welcome you, ma'am.
Dr. Varsha Lahade.
I would also like to introduce Dr. Varsha Lahade, ma'am. She is the president of Nastic OBGYN Society. She is the current chairperson of AMOGS Medical Legal Committee and the past zonal coordinator of AMOGS. Ma'am, can you introduce the other four panelists also?
Yes. Dr. Kauri Karandikar, madam. She is president-elect of Nashik OBGYN Society, director of Karandikar Hospital. She is the director of Growing Up Clinic Adolescent Health Center, Nashik. She is a national trainer of adolescent-friendly health services and master trainer, Dhira Initiative for Violence Against Women. She is a member of Adolescent Health Committee, Foxy, and member of Medical Legal Committee, AMOGS. She is a member of Society for Adolescent Medicine, International Society, and she has a special interest in adolescent health and high-risk pregnancy. Our other guest, Dr. Sudesh Doshi sir. He is a senior obstetrician and gynecologist working since 25 years in rural setup at Pandharpur. He has an experience of delivering over 12,000 babies at nursing home. He was the ex-chairperson, Medical Legal Committee, AMOGS, and he is a member of NIMC Foxy, and he was the past president of Pandharpur OBGYN Society. Our next speaker, next slide, none other than Dr. Girish Mane sir, past president of Yavatmal OBGYN Society. He was awarded as the best chairperson AMOGS in 2018 and 20. He's a recipient of Foxy Smriti Mylon Save Baby Girl Child Award. He is a recipient of Dr. Purusha Youth Trophy, recipient of Dr. Sadhna Desai Award in 2017, contributed 7 chapters in Foxy Focus. He is the editor of Foxy Focus Adolescent Health. He's the editor of Foxy FAQ Adolescent Health, editor of AMOGS Focus Adolescent Health, presented many papers in national and state conferences, and he is the first winner of Foxy Talent Singing Contest. Welcome, sir. Another esteemed speaker, Dr. Priyankur Roy. He is consultant and infertility endoscopic surgeon. He is India representative of WATOG FIGO, the Joint Secretary, Justice India Chapter, National Coordinator of Perinatology Committee, Foxy, and E-Zone Coordinator, Infertility and Endocrinology Committee, Foxy. He is Joint Secretary of Siliguri OBGYN Society, Organizing Secretary, E-Zone UA Foxy 2020. He has published
ma'am,
articles.
We'll do, ma'am. It's okay. We'll do. It's okay. Thank you so much.
Thank you, sir.
Okay.
We now move on. Over to you, Madan sir.
Yeah. Is it visible now?
Yes, sir.
Okay.
Yes, correct.
Okay. Let us start today's symposium on a sensational topic of sexual abuse. I once again welcome all today's experts, Dr. Padmini ma'am, Gauri ma'am, Varsha ma'am, Priyankur sir, Girish sir, ESS Rao sir, Kiranmai ma'am, and Sudesh sir. Yes. Yes. Let us directly go to the sexual abuse. What is sexual abuse? Actual or threatened physical intrusion of a sexual nature, whether by force of unequal or coercive conditions. Actually, it includes sexual slavery, pornography, child abuse, and sexual assault. It is a behavior by an adult or older adolescent towards a child to stimulate any of the involved sexually. And use of a child younger than the age of consent for the sexual stimulation. Uh, what is child abuse? Is it visible?
Yes.
Yes, Pardon, sir, you can go on.
Okay. Any act or series of an act of commission or omission by a parent, caregiver, or another person in custodial role that results in harm or potential for harm or threat of harm to a child. Excuse me for a yes. My question is for Dr. Gauri ma'am and Dr. Priyanku sir. Let us explain about the child abuse. What is your idea? Dr. Gauri ma'am.
Okay, so am I audible to start with?
Yes, yes.
Yes, Gauri.
Yeah. So good evening, everyone. And thank you for making me a part of this panel. And I will not go through all the names, but thank you, Foxy, thank you, AMOGS, and thank you, everyone. So as far as child abuse is concerned, when we talk about this, it has to be considered as any act which is by any parent or any caregiver or any person that the child comes in contact with, which is causing any kind of harm. And now that harm can include a physical harm, it can be an emotional harm, it can be also now, because with cybercrime, can be an online harm. So this is kind of something which is potentially threatening the existence or causing harm to a child, is going to be considered as all inclusive in a kind of a sexual or a sexual abuse for a child.
Yeah.
So more often than that, we have seen patients or children, especially in our adolescent clinic, we see young girls and boys coming to us. So generally, they will not come to you directly with history of sexual abuse, or they're not readily opened up with this. So we have sexual abuse. This, as a clinician, when I look at sexual abuse, it will be sometimes more often. Like, it will not be a direct case. Like in a private practice, we will not get patients who come with a history of rape or kind of things, but they will come with subtle signs of injuries, of body injuries, or private part injuries, or kind of infections or something like that. So sexual abuse essentially will involve a physical or a mental or an emotional abuse or a harm that has occurred or is likely to occur from any act.
Yeah. Yes, Dr. Priyankur, what do you think? Who are the main victims of?
Then you can make it slideshow. It is not in the slide.
Yeah.
Yes, sir, one line I want to add.
Who are the victims mainly?
Yeah, so Madan sir, yeah, so a very appropriate and a very important topic in today's context, because we know, though we say that India is advancing, India is going to become a developed country in a few years, but we know what the scene is in the at the backdrop, because we go through these patients who come to us on a regular basis. As ma'am has correctly said, these patients will not come and complain, these children will not come and complain that something is wrong, but we will have to pick it up from the signs and symptoms, and we'll have to look and talk to them. That's when they'll get confidence in us. So as you said, the victims, as you say, most important, as you say, is of course children, girl child with developmental disabilities or with cerebral palsies, who probably do not have probably parents or orphans, etc. Other people who can be definitely at risk. We also definitely look at children who are staying with uncles, especially the little poor downtrodden people who are working in different cities, different places where they're staying with the uncles, staying in rented houses where everyone leaves the child back home and goes out. So these are people who definitely are, these are girls who are definitely at a high risk and definitely at target. We also can talk of at risk if you talk of spouses. Like we know that teenage marriage is not over in the country, though we have a very vibrant and very, I would say,
Madan sir, may I add something?
Network connection is poor.
Dr. Girish wants to say something.
Yeah.
Hear me?
Sir.
Yeah,
Yes,
now we
yes.
can hear you,
Now
Priyanka.
audible.
Yeah.
Priyanka, please continue.
Okay. So I don't know where I left out at, but I would just like to say that the things that I were added were mainly the last point that I was saying. I think that's what got left behind. So basically, the children, we know that we talk a lot about the POXO Act. We know that child marriage is not allowed in the country and all that, but somehow in the country things are happening. Doctors are in the onus of reporting, but we know that things are happening. There are children who are getting married. There are children who are getting trafficked. There are a lot of things that are happening in the country, but somehow there is not much of a control that is happening. So child sexual abuse is definitely a part of this system, that when marriage happens at prior to 18 years, when it comes from the POXO purview, when there's child trafficking that happens, these are the things that we definitely need to look at. And I think they are the main victims who are to be looked into and who needs to be controlled. And another, that one point I would like to add, if I'm given 2 more seconds, is basically the child abuse, the examination part. Because sometimes we see when a child with child abuse comes to us, especially in a hospital, there are sometimes which a little bit of a thing of do not want to examine now, we'll examine in some time, maybe the next shift person will come and examine. Guys cannot examine, girls can examine. There are a lot of rules and things that are there, but the important thing is to sit with that child, talk to her for some time, and that's what brings that confidence back in her, which she has lost probably after this abuse.
Yes, thank you, Dr. Priyanka. Dr. Girish sir, do you want to say something?
Actually, Priyanka has covered the theme. Actually, the child abuse is defined very simple and in a very clear way, that any boy or a girl who is below 18 years of the age, when harassed or harmed psychologically or physically, is called as child abuse. Because see, there should be some specific line in between. For example, if any girl or a boy, if they are getting some such kind of things above 18 years of the age, maybe the case different, and when they are below 18 years age, the case is the different. So child abuse is a very clear definition, that either boy or a girl, because most of the time people think that only the abuse is related to the girls only. It is applicable for the boys as well below 18 years of the age, because nowadays the child abuse to the male, to the boys is also very common, and we are coming across such cases very routinely.
I would like to add one more point to what Dr. Girish said, that yes, child abuse as far as boys and girls is also very relevant, but even even abuse in boys who are above 18 years is also quite high. Most of the time not understood, not reported, not discussed, and I think our poor boys, I don't have good platform of Foxy to to talk to them. I think we need to just move ahead on that.
Yes. There is another one point, that is child neglect. Yeah. Neglect is another again of physical neglect, emotional neglect, medical or educational neglect, supervisory neglect, or exposure to violent environments. Yes, we have covered this: spouses, children, and effects of, what are the effects of child abuse? Yeah, Dr. Priyanka. Hello, Dr. Priyanka.
Madan sir, yes, tell me. Yes, sir.
Yes. What are the effects of child sexual abuse?
Yeah. So as we have talked of, one of the main things that we can look into, sir, when we are talking of child sexual abuse, is basically that after the abuse, to bring back the confidence in the child is something that we need to look.
Okay.
The bringing back the confidence in the child is something that we need to look at, because that's where the main trouble happens. Because somehow once the child goes under abuse, it becomes very difficult for that person to trust anyone else in future. And that is somewhere where talking to her, bringing back that confidence in her becomes very, very important. Plus, The other thing that I work in a government hospital here, have seen a few children who have gone through this. They go through, there are NGOs who support them. There's everything that probably tries to help. But, bringing back that confidence, bringing back that sort of a support, sort of a, what do you call it? Sort of a trust, which they can do to a man later on, is something that is very, very difficult to come back. The second thing that I've seen with this child abuse is that trusting even their partners, even after marriage, when a child gets married who has undergone sexual abuse previously, getting that trust back in marriage is also something that needs to be looked in, because that is also not something that comes very easily. And of course, we need to definitely look at things like chronic pelvic pain because of infection. There can be chance of infection like HIV, hepatitis B, hepatitis C, which needs to be checked. And also, of course, in case there has been repeated abuse by repeated partners, we definitely need to test this child with pap smear, etc., to look for any chances of cervical cancer because of HPV spread.
Yes.
Yeah.
Dr.
adding to-
Kiranmai ma'am,
Okay.
would you like to add something?
Yeah. Two things actually, esteemed panelists, experts have added so many important things. One is if the child is very vulnerable, and if the abuser is from the family, as we have seen in most cases, we had seen uncles, we had seen even fathers in such some gory, kind of cases, then it becomes almost impossible for that child to come out, and the child doesn't know that it is abuse, and the child doesn't know have anyone to protect. So that is one thing. The child has to be educated about good touch and bad touch right from the young age. And if not just parents, teachers and everybody in the society has to act as effective bystanders. And then coming to the signs of child sexual abuse, that is most important, because we even doctors do not know, what are the effects. And we had seen one case in our hospital where the baby was admitted for battered syndrome, 3-year-old, 4-year-old, and the gynecologist went and suspected sexual abuse and thought of reporting to the police because of POXO. But there was so much resistance from police, parents, father and uncle, etc., because this father was servicing, giving some service to police by supplying vans and something like that. There was so much of resistance, and even this gynecologist was threatened that not to go ahead. How can you think of child sexual abuse? It is not so. But then the RMO and the doctor had persisted, and finally it was proved that it was child sexual abuse by the father's brother, and mother had they have separated. Mother was not staying with the child, and it took whole one bold gynecologist and the administration, and there was so much of resistance, and the child nobody was ready to agree that it was abuse, neither police nor the parents, because it was the uncle who was perpetrating it. So these two things, we need to have a high index of suspicion and checklist in our mind, and there have to be more and more trusted adults, because parents, sometimes the family itself can be abusing the child.
Yes, yeah. 30% of times the father and uncle and cousin are involved, and 60% of cases the close friends, babysitters.
You are very vulnerable.
Yes,
Yeah,
thank you.
I just wanted to add one point here, Dr. Madan, that one thing is
Yes.
that here that we tend to forget that two or three things. One thing is that most of the times these children are facing a lot of self-guilt. Okay, because the society is looking at them in a particular fashion. So the children and their self-esteem, their confidence is very low. Secondly, is that they are very prone to addictions and sexually transmitted infections. Third thing is that we are talking of children or victims who have reported or have been picked up. There is a huge portion which have not been picked up, and I think awareness programs like these and many more can actually make people at least aware, because like we have spoken in a Dhira program that we cannot help somebody unless that person comes out on himself or herself. Similarly, these awareness programs need to be increased, or at least we need to reach out to bigger populations, because we are just seeing the tip of the iceberg. There is a lot below that which we are really missing. So I think we need to work on that as well. Thank you so much.
Yes.
Madan sir, very important point.
Yes.
Actually, most of the time, the doctors as well as the parents, they are not ready to accept the fact that the near person has done the child abuse. But it is common, as you and me know, But one thing very important, everybody should know that why the nearer people they are doing such kind of things, because they know the loopholes in that girl and in that family. I mean, they know that the girl will never retaliate whatever I am doing, and the family will never go against me. And this confidence gives them the confidence to do such kind of things. And that's why this message should be spread to the general public, that never think that the nearer people will do that. In fact, the nearer people are more, I mean, they are prone to
More
do
likely.
such kind of things, because they know all the weak points of the family as well as that girl or a boy. This is very important.
Yes, yes. Thank you.
And the new person will never dare to do such kind of things.
Yes.
So now when we have patients coming with infertility and male sexual dysfunction, I think sometimes going back to these histories also sometimes can be really vital and give us some more information about this, because sexual dysfunction in males and females can somewhere relate to sexual abuse in the past, or some similar experiences. So I think we need to add it in the checklist for male sexual or female sexual dysfunction.
Yeah. Yes. We will go to the next issue. Human sex trafficking. Yeah. I would like to ask Dr. Padmini ma'am, what is human sex trafficking?
At the outset, I would like to thank all the concerned persons for inviting me for this beautiful and wonderful seminar with so much of knowledge sharing and extremely important topics, especially in the present day, with all the exposure to social media, internet and dating sites and all that. The chances of getting abused and getting into the trap is all the more increased. So coming to this trafficking, that this recruitment, transportation, transfer, harboring or receipt of persons by means of a threat or use of force or other forms of coercion, of abduction, of fraud, of deception, of the abuse of power, or of a position of vulnerability, or of the giving or receiving of payments for the purpose of exploitation. And this is what is the definition by sex trafficking definition: recruiting, harboring, soliciting. This is especially for the purpose of commercial sex. And the traffickers, they exploit not only the women and girls, even the men and the boys. The girls, women, men and children, they all become victims of this violence. And this includes all races, ethnicities all over the world. It is present equally common in all places of the world. It is for the purpose of sexual exploitation, which is also called as modern slavery. Victims are manipulated in various forms of commercial sex, non-consensually. For a child sexual abuse and trafficking, even the consent is not required. And for the adults, without the consent against their wish, they are trafficked. And this domestic minor sex trafficking also has increased a lot. And ultimately, the consequences of sex trafficking are similar to the consequences of sexual violence, which can be immediate or delayed. The commercial sexual exploitation of children or domestic minor sex trafficking, there are several forms of exploitation, including pornography, prostitution, child sex tourism, and child marriage. The exchange of sex with a child under the age of 18 for gain of cash, goods, or any valuables. So this has become extremely common, but many cases do not come to light, and so many are unreported. So now one estimate says that nearly 45.8 million people who are trapped in this trafficking, they're present in the world. So, but this is only just a tip of the iceberg, and so many go unreported. And this, once they're caught in that web, and it is extremely difficult for them to come back and again come back to the mainstream and lead a normal life. So even those who at least they may happen to come out of it, still they suffer from immediate and long-term effects. And you have heard so much, you must have seen in so many movies and the serials, they depict all this trafficking, how they are lured with jobs abroad or in the Gulf. And so they got in the hope of getting, especially those who are vulnerable people, their poor poverty, and then this illiteracy, and those who do not have any jobs, and those people, they're really interested. And those are the people who are vulnerable and they are really targeted. The profile and modus of traffickers, the pimp control trafficking, gang control trafficking, the victim is controlled, the familial trafficking, cyber sex trafficking, forced marriage. All these are varieties of sex trafficking. So this with the cyber sex trafficking, as I was telling, with the increasing usage of social media, and this any individual who is really vulnerable can get into the trap of this sex trafficking.
Yeah, TSS Rao sir, would you like to add something? Hello.
Hello. Sorry. Of course, madam, very clearly brought the picture that this trafficking and range of ways actually this can happen, and the issues involved of those people who become victims, and unfortunately leading to range of problems. See, wherever coercion is there, wherever exploitation is there, wherever victimization is there, unfortunately, whole range of what we call physical, psychological, economic, and many other such actually problems definitely crop up. And these leads to the range of abuse patterns, say starting from maybe the harassment to rape to, in fact, extreme forms of sexual violence. All these things actually happen, and somehow, in fact, the range is what we can talk about is the factors involved are many. In fact, the vulnerable groups, actually, this has been emphasized. What age it happened, in what context it happened, and the amount of, in fact, the capability of the individual to face certain risks and consequences. So many such actually aspects determine. So from that angle, this is one of the very important area, and we practicing in certain settings and clinics, we won't come across. But when we realize certain documentaries made and the newspaper reports that come up, and some particular person is caught and penalized, then only we realize actually the issues involved. So, for example, in Mysore, we have certain NGOs who have really gone out of the way and trying to find out all these type of things are actually happening, and many of the things what we talk about, starting from prostitution to a lot many other things. In fact, where people are forced and other related things, quite actively being done, and day in, day out, in fact, the news items what one can find. More probably, in fact, bigger, more cosmopolitan, metropolitan cities, the problem would be much, much higher. The other one, what we realized is actually, say, I practice at a place like Mandya, a small place. Only recently we realized so many people have migrated to bigger cities for better opportunities, but all of them won't land with actually proper opportunities. They land with hands of a lot of
false promises. False promises about jobs. Yes.
In fact, I was realized. In fact, I realized in one of the taluks of Mandya district, the number of people who have migrated to city like Mumbai is something phenomenal, and in fact, the number is something mind-boggling. In fact, many of these type of things we were hardly ever knew. Only when it became apparent and came in the news and a lot of other such things happened, then only we realized all these things.
And for so many land in the red light areas, ultimately when they are taken to the bigger cities for jobs, or in the hope of getting a job, or in the hope of getting married, so the girls fall prey to those victims. So the consequences to victims can include all these sexually transmitted infections, poor health-seeking behavior, mental health complications, alcohol and drug addictions. Average lifespan of women can also reduce because of once they are into prostitution and become victim of many diseases.
It's a big social issue. It has so many bad
it's a very big public health problem and social issue. And so the all these NGOs, as you are telling, they are all finding out the vulnerable people where they are affected, and then tracing those people or where they went for job and who are the ones who promised the jobs. So some of the NGOs are really doing a great job in preventing, at least to a certain extent. It's very difficult, very big racket and very big business for people who are involved in that.
Yeah, it is very difficult to break the chain,
yes,
chain of traffickers. And it's a big challenge actually. It's very dangerous.
dangerous. So those who go with
for
that,
the victims. Yeah, it is
yes.
dangerous for the victims to come out of that.
But the point, the word used was that iceberg phenomenon.
Yes,
What we
yes.
see, what
On the very tip of
was
the
only a
iceberg.
small tip of an iceberg.
Yes.
Problem is so big and network is so wide.
It is a global problem.
Yes. So as
Madan sir, if I
medical
can just-
professionals, we can only treat whatever they come for the rehabilitative aspect of it and treating the infections and other things. But really very difficult for doctors to give a lot of contribution in a bigger way.
Madan sir, if I can just add on a point.
Yes, sir. Please.
Yeah. Thank you, Madan sir. So basically, I just wanted to say, Rao sir, very important points made. Sir is actually her daughter. His daughter was my intern when I was doing my MBBS. So it's a pleasure to see sir again over here. Sir, such a pleasure. Thank you, sir, for being here. So this one, as I was
sir
saying,
cannot see you.
ma'am,
Just
sir,
remove your mask. Remove your mask. Sir is not able to see you, no?
No. I have
Yes,
spoken
sir.
to him and
Okay.
so nice. He is from my same institution.
I know. Thank you so much, sir. This is the human trafficking thing. What I was saying was, especially being from a smaller place like in Siliguri, we have the neighboring state of Bihar, the Assam side on the other side, and this side we see a lot of case of human trafficking. Not only the thing is we talk of trafficking because of promises with job, promises of something of that sort, but we see a lot of trafficking cases here, not only for job but within the own relatives itself. We see a lot of cases where the mother has married, it's a stepfather who sends to mother sends to a relative's place and gets trafficked. And especially cases from here, the trafficking is very high in the neighboring countries like Nepal and Bhutan. We see a lot of these young girls who gets trafficked to Nepal, Bhutan, and Bangladesh. And also similarly, we see a lot of Bangladeshi girls who get trafficked into India. Again, so it's, as you said, correctly said, it's a worldwide problem. It's a problem which will probably, it's a difficult phenomenon to stop, I would say. But the thing is, from our side, I think the maximum that we can do is if they come to us, if any of these girls come to us, even if they are not able to pay or whatever it is, that bit of empathy and apathy that we need to show, and we need to take care of them, take care of their infections. And probably now that Government of India, another point that I wanted to make here was that since the Government of India has started the vaccination as being the national vaccination program, so that is another thing that we can slowly maybe promote through NGOs where cervical cancer vaccination can be administered to them, so that at least on that part, the cervical cancer part, the HPV infection part, it can be safe for these girls, because we know that the plight that they go through is something that is unbearable.
Yes.
I think Priyankar very well said, as the problem is such huge problem and we don't know how we can go about it being gynecologists, but you have made two relevant points. Shed our judgmental attitude and be empathetic and try to help them out, and about the vaccination. I think two very valid points.
Yeah,
Yes, one more point I would like to mention here is that as far as trafficking is concerned, is that we have to make our children more cyber safe aware, because that is the place where now with the person who is going to do some harm has entered our houses in the form of our mobile phones. So it is important that we have to really make our children cyber aware and about all this online media and all these kind of friendships and exchange of information that goes on. That has to be like one of our integral part of some program world countrywide to know to protect our children and women and everyone, I guess.
Yeah, not only the children, the parents should be educated and the children should be get aware. So awareness is the only thing which remains with us as an organization. What we can do is the awareness.
Yeah, there is a big vicious cycle of demand and supply. There are people who are there. This as long as there is a demand and the supply also is there, and they find out various ways and means with all these false promises, either a job or a marriage, or put them in a trap of debt, so that till they finish their give back their money, so they are trapped. So there are so many ways and means, and if we doctors come across them, and as you said, it has to be a non-judgmental attitude and do the best whatever that is possible. And there are in cities like Bangalore and even in bigger cities, we have all these short stay homes where these girls or the woman, if a girl has run away from such places, there are also places, short stay homes where they are rehabilitated, they are kept for some time. They're educated and then they're made to stand on their own legs. So all these opportunities are also there. So to counter all that, whatever possible that we can do, we have to do. And as you said, the awareness, education, and even right from the young age is very important.
So very nice point, Dr. Padmini, that these foster homes or the safety homes that are made, these are places where as doctors, we can sensitize and, try to help them in whatever way we can, because that is a place which has to be made actually more secure for them, a place where, they can at least look forward to us sending them back home or into better secure environment rather than where they have been pushed into.
Correct.
Okay, thank you for your great inputs. Actually, it is a very large subject to discuss.
Yes.
We will move on to next issue, that is sexual harassment and misconduct. What is sexual harassment? Dr. Kiran, my ma'am.
Yeah, it is basically the sexual abuse or harassment is a violation of the fundamental human right that our constitution has provided. Article 14, 15, 16 have given us. And sexual harassment is, I think right from the beginning, it is like expanding to 4 or 5 things and expanding into more and more things. So basically, you can say any kind of sexual advance or physical contact, and making sex-colored comments, offensive comments, and anything like voyeurism. There are so many things. I think because of DIRA, we have one module which is types of violence, which clearly mentions all the aspects of sexual harassment and misconduct, right from sexual assault to voyeurism to eve teasing to catcalling to stalking. Everything comes under sexual harassment. So it is advance or physical contact, and then forcing them to have sexual contact by promising them some favors, or by threatening them that by using control, either in office or wherever that person is in a position of control, whether it is partner, boyfriend, or a boss, or anywhere, and to showing pornography and sending sexually suggestive communications and name calling, using slurs. All these come into sexual harassment. And so this can be either by favors, promising favors, or even using threats. So
Yeah. Again,
so this exploitation is basically a power equation. It's a power equation. Sometimes, it is using the abuse of power. So to gain sexual favors, which again is Me Too movement, which we have seen. So it has come up very late after many years, and there were so many comments that they are coming up now. But we can understand the situation when the person who is in more powerful position than you, in an educational institution or an office or a hospital, wherever it is so difficult to come out against that person publicly or to report. So this exploitation is like hugely underreported, and it happens everywhere. I think depending on the opportunity, depending on the situation.
In 19% of cases, victims
And
know that.
again, people, they know the abuser. Yes.
Yes, and 1 in 6 men will experience in lifetime. 1 in 3 transgenders, 1 in 3 girls, such a huge incidence, and 1 in 5 boys also experience before the age of 18.
If we take all the forms of sexual abuse or assault or this thing, so I think every girl would have faced, including all of us, some kind of either eve teasing or catcalling or molestation or some kind of abuse. Definitely each one would come out when they were young. So sometimes it happens, mostly it happens because of the power equations.
We go by the book's definition, I think the incidence is almost 100% in India at least.
Before the 18, yes, before the 18.
It's not only
and one thing about this is mostly the girls do not come forward, because whom will they tell? The parents, especially in our previous generations, at least in our generations, when we try to tell that someone has done this to me, the fear was that you would be made to sit at home. You will be judged, you will be shamed, you will be blamed. And I have heard one of my colleagues telling that she was a medico, and one of the PGs has, kind of used his situation as senior, trying to teach her surgery and trying to molest her, but she has not come out for 20 years. She told some of her friends, and her friends, all of them have told why it happened to you. And this person also felt so guilty. Is it something wrong with me? He hasn't done this to anyone. He has done this to me. So this kind of thought process exists, and most of the girls never tell, especially these minor, we can say minor or mild types of even serious things, either at home or to anyone. That
Absolutely.
system of society that we have, we never encourage our girls to tell anything, or you find fault with the girls, then who will they tell? Who will they tell?
Actually, the reported
Agreed
cases we see, actually these are underreported cases. Figure is
Absolutely,
yes.
Madan sir, as Kiranmay ma'am, Dr. Girish Manesha both have very correctly pointed out, I think 100% I would say. And I would also add on one more point, the sexual harassment and misconduct that we talk of. We will talk of girls, of course, as the majority, but we will to a certain extent talk of male as well.
Yeah,
because the thing is, it's misconduct, I would not say, but maybe harassment. Because the thing is, we know how the rules in the country is right now. Any sort of a allegation, if it comes up, is on the onus of the guy to prove that it is wrong and it is not right. Even the Me Too movement that started, we know that there are a lot of people who got this was of the Bollywood industry and all big people. Maybe we know that things happen there or doesn't happen there, but we cannot say that every bit of the thing that came up was right also. We know that there could have been instances.
Priyankur, that should not deter us from
no, ma'am. I'm not deterring anyone. I'm saying it definitely does happen. I'm agreeing to your point. As I said initially, I started off saying you and Girish Manesha was absolutely correct. It's 100% of cases. But I'm saying just the
let me give the statistics for the male versus female. Actually, these questions. No, Priyankur. No. Let me clarify.
Yes.
Because these questions we have to answer them. Some of the boys in DIRA programs have very clearly asked us. Then I had to go through the statistics. I had to go through the statistics. Then when we check the homicide part of it, where women killed by intimate partners, it is 38%. Whereas it is again men are killed by women partners. It doesn't. It is not that it doesn't happen, but it is 6%. The statistics and the numbers are totally weighed against women. But at the same time, we should not disregard the fact that it can happen to men, it can happen to boys. And that has to be kept.
That is the point I was saying, ma'am, that as you said, you and Girish were absolutely correct, saying 100% of women at some point of time, as you said, eve teasing, college, we are in the hospital industry. We know that there are nurses. There are a lot of things that happen in and around us also. We know that everyone goes through things. But I was just trying to make a point that, as you said, 6%, but a very small minority maybe. But there is this harassment thing that is also there, that stays at the back of the mind.
Again, Priyankur. Again, Priyankur.
Yeah, Dr. Kiranmay, actually.
Yes.
I just wanted to add one point here, Dr. Kiranmay. Sorry for interrupting you. I think what Dr. Priyankur is trying to say is that he completely agrees with you that yes, the percentage in women is higher than in men, but then we also should not ignore the boys and the men who are also facing this. Because like you rightly said, the first program of DIRA that we took in the school, we had one boy coming in and saying that, don't you think the laws and everything is so feminist in this country, and we are now going to land up nowhere. I mean, we cannot have our normal hormones moving at all. So we said no, it's not like this, and we had to explain exactly like way you did.
Definitely,
that the percentage is higher, but it is not very low. Especially in metros, you will see that. I would not say that boys are not getting abused.
Ma'am,
but again, Priyankur, the boys and men do not come forward for another set of reasons. Because they are supposed to be strong, they are supposed to be, they can't say that they are being abused or sexually harassed.
Ma'am, that's why I said I didn't talk of abuse, I talked of harassment. I didn't talk of abuse. I said in the beginning that sexual abuse, I do not talking of
harassment and abuse.
And also I'll tell you, ma'am, we have a small nursing home here in Siliguri. So even in today's day, I am scared myself to walk in a lift with probably one staff nurse is walking, or even in my room, call a staff nurse and probably talk to her alone. I always tend to have a manager who's standing beside me or my assistant who's standing beside, because you never know where allegations will come. You never know what is going through someone's mind and when what will happen.
Allegations will come.
That things we need to be very careful of.
So we have to become now aware that even men in our country should not feel insecure, right, Priyanka?
So anybody can be insecure.
Can
I think
Okay,
Rao sir was wanting to make a point.
most
Yeah.
of
Yes,
these
sir.
cases come to light, especially when they come for sexual dysfunctions, non-consummated marriages as adults after, because so many times it is kept in the deep-seated mind, the scar which is there in the deep-seated thing. So that will come out and it can present a sexual dysfunction in adult life. So many of these things when they're molested, harassed, or boys, so many times they come and tell, as a boy in a residential school with a teacher, I was harassed by the teacher and abused by the teacher. And now I am so scared. Now I have developed erectile dysfunction and so many of sexual dysfunction. So it is both ways, whether it is boys or girls, both are vulnerable these days. So it is very difficult. So we should keep an open eye when they come for some sexual dysfunction, when they come for non-consummated marriages, when there is a hostility between the partners and disturbed interpersonal relationship. All these things may have a deep-seated background at the mind of some amount of sexual abuse or sexual harassment.
I just wanted to make one small point. What Dr. Priyankur Rai was talking about and the other expert, this thing. See, when we are trying to talk about harassment and other related things, what is actually being reported and what is actually being considered as something important, there is one aspect of it. You must also keep it in mind. There are a lot of other related issues. See, there are some people who are so sensitive for anything which they actually can interpret. What we have to keep it in mind is actually starting from the personality pattern to certain disorders, wherein even very minor these things, even absolutely there is no harassment, but people have been blamed and a whole lot of things have happened. Let me tell you, in fact, making allegation is sometimes extremely easy. Many people in authority and all of that have got stuck with a lot of difficulty, not because of anything, but because what we consider victim actually suffering from one or other type of disorders. And about that, in fact, if time permits, I will talk about it later. There are very significant, very sensitive personalities are there. Certain types of disorders are there where actually things are interpreted wrongly. In fact, they can be so strongly convinced about something has happened that they can go to the very extreme form. Actually, they can fight in a very different fashion. But as a psychiatrist, we have to keep in mind all the aspects in together. That means person's issues, the other person's issues, all these things we have to look at it from a very close angle. One caution, word of caution related to this type of allegations that come up frequently.
Yes, thank you, sir. Thank you all for great inputs. We will move on to next very important issue, that is female genital mutilation.
Yeah.
Which is called female circumcision also.
Yes. You have brought out a very important topic because many have heard about it but do not know exactly what it is and the extent of it and who is going to have all these problems. And it is an extremely common thing, more of socio-cultural problem rather than a medical, and also a medical problem. So that involves a female genital mutilation, involves the partial or total removal of external genitalia or other injury to female genital organs for non-medical reasons, and it has no health benefits, and so it can cause serious problems. And certain communities, they are as a cultural thing, as a religious thing, they are undergoing this. But this has been really taken as a serious issue by World Health or WHO, UNICEF and UNFPA. There are varieties of how they are removing that, whether it is a partial or total removal of the external genitalia. So there are various types of FGM, and in type 1, there can be partial or total removal of clitoris, whether the visible part only as the hood or the prepuce can be removed. In type 2, the removal of clitoris along with labia. It can be minor alone or with the major or both the things removed. In type 3, there is sewing of the labia together to make vaginal opening smaller. This is also called infibulation. The type 4 includes all other harms to female genitalia for non-medical purposes like pricking, piercing, cutting, scraping, and cauterization. To give you one example, I was working in Saudi Arabia. So when suddenly, because that was the first time I saw that, so I saw that And I called the other doctor. I'm seeing from some congenital abnormalities, congenital abnormality, come and see this, because external genital looked extremely different. Then there was a Palestinian gynecologist. He's told, no, this is a female FGM and it is not a congenital abnormality. That is the time I got this first time to know about this practice which was there. And the lot of people, when they came for delivery, it was really causing so much of a problem for them. Like posterior episiotomy, we used to give anterior episiotomy, cut open the anteriorly, and women insisted on suturing it back and bringing back to the original status, not to leave it like that, though they experienced so much of problem during intercourse or during delivery. So this was the thing which I really have seen with my own eyes. And see the reasons for FGM practice. One is the social acceptability, which is the most common thing, to help ensure a woman remains a virgin until marriage. And it is they think it is a hygienic, removing certain parts which are not clean. By removing that, it is a hygienic thing. A rite of passage as a ritual to be a woman, and it is considered suitable for marriage, and it's as a religious duty. And there is a belief that it increases sexual pleasure for man. These are various reasons given for FGM practice. And effects of FGM. There can be immediate problems, and there can also be delayed problems. There can be severe pain, serious, because they were doing it with some crude methods and not with the medical help. And they were doing right from the infancy up to young girls up to 8 years, 10 years, which caused them severe pain, bleeding, and some infections, which is and additional trauma, urinary difficulties, and some people, some girls who bled, their death also is a possibility, and problems having sex, and there can be a problem with the intercourse in the later life after the marriage, depression and anxiety because of the traumatic experience for some girls. That is one of the reasons. And this violates children's rights, human right violation, right to be free from discrimination, right to be protected from all forms of mental and physical violence and maltreatment, and right to highest attainable standard of death, right of freedom from torture or other cruel, inhuman or degrading treatment or punishment. Because it is taken more as a social, cultural thing. And but these are all the things which have been described, and WHO has taken it very seriously and given a statement against that it should not be conducted. And now there has been a medicalization of this. So some of the doctors who are willing to do it under sterilized conditions and not causing so much of problem for the girls. But whatever way, whether it is their healthcare facility, healthcare workers are involved in that, or whether the practice is there. So WHO has given statements against this FGMs.
Okay.
This is the rights violation, and various forums, as I told you, immediate and delayed problems are about this sexual relationships, and also during the childbirth.
Actually, it's a big problem globally, and
Yes.
there is so much expenditure on the complications of
Yes.
this thing in billions. Expenditure is in billions in other countries.
Yeah,
and
when you are
mainly
treating this, correct.
yes, only around 30 countries are more prevalent for this. These are the poor countries, mainly Somalia, etc., where it is practiced more.
I think it is difficult to believe that such practice exists even today, such cruel and very inhuman.
And this is called, actually, our medical personnel are involved more, and this is called a medicalization there in other countries. Yes, we will move
So
on to
because in
next,
some countries, actually, I would just like to add that as it sometimes is made a part of the religious customs, to have this female genital mutilation. There are some religions which are fighting against this as well. So it is not always only about some violence, but it is, I mean, yeah, it's at one point needs to be corrected
yes,
by
many
that.
governments.
The religious things, as I said,
Whatever it is violence.
social cultural thing as a part of it, as a custom they're following. But
Many
some people are also talking about that.
many states and many NGOs are working against it. Yeah, intimate partner violence. It can be physical violence, sexual violence, stalking, psychological aggression by current or former intimate partner. The spouses, boyfriends, girlfriends, dating partners, or sexual partners. It can occur in heterosexual or same-sex couples, also called domestic violence. Yes, I would like to ask Kiran, my ma'am, what are the consequences of intimate partner violence?
Consequences can be the pathways, how it affects is like it touches every aspect of the health of the woman, right from, you can say from birth, pre-birth, right from, if you ask about violence, total violence, but intimate partner violence, the whole of reproductive age is gone. We have seen physical effects. I mean, the stab injuries, the kicking, where many times we are not aware of the, how to see, just as in child sexual abuse. When we examine, when they come with repeated obstetric problems, especially PROMs and then preterm labors, anemias, preeclampsias and eclampsias, late booking. This is their obstetric behavior. You can see the care-seeking behavior. That care-seeking behavior is very, very poor, and they come in late complications. And when you seek the history and the background, definitely 90-100% of the times you'll find violence behind it. I would just narrate one case. This is not physical violence. How I would like to say this as reproductive coercion or violence, how it affects the woman's health and finally led to maternal mortality. So this woman was a severe preeclampsia with severe edema, and BP was 180, 110, 120. So we counseled, took video consent. We told them about termination of pregnancy, but husband was very persistent that he will not admit because it was preterm. He just told us that he's not going to admit. He took her home and kept her home. So for one whole week, the whole health system was behind him. The NM, Asha, medical officer, everybody was touching base with them to get her admitted and all. So he delayed for 1 week. Then he got her with eclampsia. Then at that time also we counseled, and finally we did LSCS, but she landed in severe pulmonary edema, abruption, and finally she succumbed. It was a maternal mortality. You won't believe that which was violence against women, the intimate partner violence, how it has manifested. We could not tell anybody that it was husband who was doing all this because he had put a FIR on the hospital, FIR on the treating doctors, that because of the neglect of the gynecologist, his wife has died. So finally the FIR was there. We were defensive. We had to give explanations, conduct inquiry, and we could tell only the collector, but he went scot-free. Even today, he's roaming scot-free. It was, I would say, a kind of homicide. She died because he failed to admit her, and he prevented the treatment that was due. This kind of behavior is what we see in, I see in intimate partner violence. I'll not talk about physical effects and other things. They are very well seen. But this is reproductive coercion, reproductive violence. And I think 70% of our women do not have a choice to choose any family planning method, choose to continue pregnancy, or choose to go for abortions. We know of women who are given MTP pills. We know of women who undergo sex selective abortions. We know of women who are neglected so much that they land in such dire consequences and near miss. And there are a lot of psychological effects, trauma, then depression is more, HIV is more because of intimate partner violence, because he will not use any protection, and she will not be able to negotiate any condom use. So there will be a lot of STIs, a lot of pelvic pain, and a lot of gynecological problems, depression, anxiety, so many things. So you name it, you have it. The violence is one underground, the background, you can say, which many of us, not many in the society will not be able to see. But again, you should have eyes for it. Then you will understand how it plays in the health of the woman.
The problem of teen dating violence is increasing in the school, this population. 1 in 10 high school students have experienced physical dating violence. In metro cities, this problem is increasing day by day.
Yeah. Of
Okay.
course,
So
there's so
I
many
would,
acid kind of thing, and then so
yes.
many forms are there. So many forms are there.
Rao sir, would you like
Yes,
to
yes, yes, yes.
highlight on post-traumatic stress disorder, what it is actually?
Yeah, before coming to post-traumatic stress disorder, let me just look into this problem of intimate partner violence or domestic violence, what we talk about. See, the one of the issue which has been brought up is actually that any relationship for that matter, whether marriage or even cohabitation, lot many things, lot of expectations are put. And once something is actually missing, in fact, one is actually the problem created. The second one is actually the neglect. But when we are talking about couple therapy and lot many other things, many of the times, many women actually come and what they say is actually, in fact, not getting the adequate love and affection and other related things for various reasons. See, before marriage, after marriage, the courtship, and then subsequently, there is a wide difference is bound to be present. And when we are talking about from psychological perspectives, see, what we have seen is actually there is something called symmetry and asymmetry. Symmetry when in fact both the partners are equally aggressive and can get into difficulty. Asymmetry, what actually we are talking about. See, many of the times the lady is the victim and a whole lot of things that happen, and associated with that issues of drug abuse, pornography, and other forms of paraphilic and such other things which are actually prevalent. All of these type of things actually contribute. And any violence for that matter, or anything actually, which is actually where love and other related aspects are missing, produces psychological issues is actually something extremely common. Coming to what we call the type of specific disorders, we're all well aware, anxiety, depression, certain phobic type of reactions, and the individual can become extremely sensitive to a lot of things. So one of the disorder which was recognized was post-traumatic stress disorder. See, earlier time was there, maybe even about 20 years ago, we used to say that in India, there is no post-traumatic stress disorder. And now we are aware that it is as good or as common and as frequent as what we say in the Western countries. The important point here is actually what we say, when something is unexpected, catastrophic, something sudden, violent. In fact, it is spoken very often in terms of maybe tsunami, the volcano eruption, and lot many other things. But you coming to the domestic violence and other related areas, it can shatter the individual's ego to a certain extent, and a whole lot of problems can happen. We divide into two patterns. One is actually says something happened, everybody goes through. Say, for example, death of somebody, we talk about grief reaction, specific name is there for that. Or when trust is broken for various reasons. Whole lot of anxiety and other related things what an individual goes through, in fact, they are called as the acute stress reaction. If this problem persists for more than 1 month and can go on for pretty long time, in fact, then we use the particular terminology called post-traumatic stress disorder. It has actually three important issues. One is actually, in fact, reliving. See, something which can come to the memory and can trigger a range of reactions and all that. The second one, actually, in fact, these people can become significantly sensitive for a lot many things. And that is what actually, which leads to what we basically call as hyperarousal. What it means is always expecting danger and how reaction will happen. Many of the times, husband coming home means the lady is presenting with a whole lot of fear and other related things, because how it will go and what can happen and all of that. So from very minor form to the extreme forms, people have documented. If we can remember this much, that range of anxiety, depression, and other psychological factors present, recognized properly, and in fact, treatment, non-pharmacological, whole range of methods, what we basically call counseling techniques, to, in fact, sometimes necessary for the drugs, and reliving some of those type of things made use of in therapeutic processes, they all become necessary in certain situations. And so also, apart from psychological factors, sexual to other relationship and lot many other things are bound to be there, and one has to keep all those points in mind.
Yes. Thank you, sir.
The other
There are-
thing is of late, we are seeing more and more cases of live-in relationships. And this intimate partner problem is all the more increased because of the live-in relationships. Because there is no binding also for them, and then a lot of quarrels and killing. And recently you have seen how the lady was cut into pieces, so many, every day one number of pieces, the body was cut into pieces. All those extreme forms of rage phenomena, sexual exploitation, and this the partner violence, whether it is physical, emotional, and sexual abuses. And we are seeing more and more cases of live-in relationship violence. So that is all the more increasing. And now they talk about the marital rape is coming up. With the intimate partner. Now they have fixed one date to give answer from the Supreme Court also, I read today. So all these things are getting important more and more in the present day situations.
Yes, exactly.
In
There are
Journal of
so many
Psychosexual
strategies.
Health, what we publish, the last editorial was on marital rape and current situations. In fact, I request everybody to look into that. In fact, we went through a lot of issues involved.
Yeah.
Maybe out of India, certain context to and Indian context, how precisely and what can really happen and how things can go. We have assumed few of the things and we have brought all those factors in mind.
Correct.
Yeah. Thank you both. We will move on to rape victim, examination of rape victim. There are so many types of rape: date rape, gang rape, marital rape, rape of children, prison rape, serial rape, so many types of rape. Date rape is also increasing today because today's culture is changing so much. Gang rape and marital rape. Sir was talking about the marital rape. I would like to ask Dr. Lahade Madam.
Yeah.
About the examination of rape victim, how we should proceed.
Yeah.
What
Am
are
I
the current
audible?
guidelines?
Yeah. Am I audible now?
Yeah, yes, ma'am.
The medical practitioners plays a dual role in responding. Let us not call it as a rape. Let us call it as a sexual assault and a survivor examination. I would be talking on more of the examination part. The first is most of the cases comes to the public sector, and private sector don't examine these cases. So I would through this media, I just wanted to highlight that every private practitioner should see the patient. They cannot deny the treatment as well as the examination. This treatment is free of cost, and those who fail to do so would face the punishment. So whenever the victim comes to you, ensure the safety of the victim. The second part is you should have a secure place and a safe place for her. It should be clean, and the girl who you are going to, or a boy you are going to examine, need unconditional support. So the relative has to be there. So the next thing is you yourself and your staff should be very compassionate and should not be judgmental while examining this patient. You can get the patient who has only a simple, maybe some injuries, or you can get a patient who would have a very serious injury where you don't wait for an FRI. You don't wait for any police complaint. You just have to inform them and you have to start treating the patient. Second thing which comes is informed consent. If the girl is less than 12 years of age, you need to have either parents, guardians, or what we do in a public health, we take, if nobody is along with her, we take consent of the police who brings the patient and the
The connection is lost.
loving care. For you have to reassure the patient, then give her a psychological support. In your clinic, you should have a sexual assault kit, which brings a big list of instruments which contain some gloves, a mask, syringes, then swab sticks, as well as there is a number of lists. You can get it on the website. First of all, you have to take the history. The history should be word for word. So you cannot change the words what she is giving the history. So very important is word for word history. Take detailed history. Don't be more sympathetic, be empathetic to her. And after the history taking, because if you do not get any evidence in the examination, the history carries a weightage in the law, in the court. So you need to take the proper history. So general appearance of the patient is to be seen. You take these are 13 pages of form, which is a new form which has been designed on 7th of August 2015 by Public Health. That is on the website of maharashtra.org.in. So it contains everything detailed: the name of the patient, the OPD number, the inpatient number, the name, who has brought the patient, the address, the age, and a number of things. In this, we should tick mark the things. Everything should be filled. The relevant medical history. Just go to the next page, Madan. Yeah. Then the date of being examined, the time when you start the examination, end the examination, then the description, then the type of the violence which is used, if any. You need to ask her what kind of violence was used. The emotional abuse should be mentioned in the words. Then any history of drugs should be taken, whether she was intoxicated or she was unconscious. You need to ask her. She will not give you history in one go. You need to take her in confidence and ask her the history. Then you have to ask what was done: touching, fondling, kissing, condom was used or not, lubricants were used or not, what kind of lubricant was there, and you need to ask these things. One more thing is to be, I would like to highlight is the survivor should not take the bath or should not change the clothes, and she has to be examined immediately before she take a bath, or if she go for the urine or the other things. So then the evidence will be proper, and whether you have to mention whether she has changed the clothes, she has changed the undergarment, she has washed the clothes, whatever the things has to be mentioned. The general examination comes pulse, BP, and pupils, respiratory rate, and blood pressure. Then comes the injuries on the body. The format of that examination format contain this diagram, where you have to mark, we have to mention whether there was contusion, where there's laceration, where there were nail marks, scratch marks, whatever. You need to examine the inner side of the thighs, the inner side of the arms, the neck, then the chest, everything from head to toe. You have to examine the ligature mark, you need to see. Then comes the local examination, where you need to see the urethral meatus, the vestibule, the labia majora, minora, faucets, the hymen. Yeah, if you need any microscopic instrument, you can use a colposcope to see the minor lacerations or any injuries over the perineal area. If any other you could see any other injuries, you could mention it there. Per vaginal examination, per specular examination should not be done unless required any injuries detected there. And two finger test is obsolete now. You should not do, and you should not mention it. Per speculum finding should be mentioned. Then the anus and the rectum, as well as the oral cavity, is to be examined. Whether you have to see the inner side of the lips, they should be examined. The systemic examination, central nervous system, look at her stress levels, whether she has been depressed, whatever you need to mention. The cardiovascular, respiratory, and the chest and abdomen has to be seen. Next, please. And then comes the sample collection. This is very important. This is for the evidence. For this, you need to take the blood sample for HIV and VDRL and HBsAg. Urine tests for pregnancy is to be done, the ultrasound examination and internal injuries to be seen. X-ray, if there is any severe major injuries like fracture of the bones, then the in sample collection, you need to collect the debris on the blotting paper and the cloth for the evidence. The swabs are taken, the hair samples are taken, the nail samples are taken, the oral cavity swabs are taken, the blood is taken for this EDTA for the in the fluoride you have to take it for the alcohol or any drugs, and in EDTA you need to take it for the DNA sampling. Urine sample has to be taken, then genital and for the these all samples to be sealed and packed, and you have to write the name of the victim, then the age of the victim, the police constable number is written on the pack, and then you have to sign it, and the date of the collection of the sample have to be mentioned. Second part comes is treatment. I was supposed to talk only on examination, but the second part, you need to re-examine the patient for after 1 week, 2 weeks, 6 months. She has to be examined, psychological examination, as well as some sexual transmitted disease may be evident after 6 weeks. So till 6 weeks you have to, or a pregnancy test, you need to examine after 2 to 4 weeks or 6 weeks. For hepatitis B and treatment part, you need to give her hepatitis B vaccination, empty pills if she's pregnant. Then you need to treat her wounds, as well as you need to give her tetanus toxoid prophylaxis and treatment of STI. And all these treatments has to be mentioned whether you have given it or not, and this whole format is to be signed and by the name of the doctor, and the seal is to be kept, and then this again annexure has to be put it into this envelope, sealed it and handed over to the police. One copy is kept with you. So that is all about the examination.
Thank you,
Sir,
ma'am.
Thank you.
So I
Evidence
think,
collection.
Sir, very important
So,
aspect. There are some
uh,
differences in the examination of a victim in a POXO and in a rape case. According to the POXO Act, any person who is below 18 years of the age is termed as a child. So these points, they are valid for the boys as well as for the girl, but there are again some differences for the examination of the boys and girls. If the victim is a girl, then the examining doctor should be absolutely a lady only. But whenever if she is in need of any emergency treatment, then the male doctors can give. Second thing regarding the consent, the age of the consent by a child is 12 years, means you have to take the consent from that boy or a girl who are about 12 years of the age, for example. And why I'm telling you that, because see, along with the consent of that boy or a girl, you have to take the consent of the parents, and if the parents, they are not present, then any other person in whom that child is having interest or trust, you can take the consent. But sometimes if the victim is from the home, then sometimes the parents, they are not ready to give the consent, and in such a case, if the boy or a girl, they are ready to give the consent, and if the parents are not ready to give the consent, then any authority from the hospital can be a parent of that girl or a boy, and they can proceed for the examination if provided that the boy or the girl, they are I mean giving the consent for the examination. So these are some differences in
Yeah.
So another thing is
I will just,
the examining doctor. It's very important because one case came across. First, the doctor has to be very sympathetic, empathetic, and non-judgmental, and that is the major necessity. One patient explained, and then when I was crying with so much of pain and shame, the doctor told me, "Why are you crying? You should thank God that at least you are alive." That was the comment made by the doctor. So sometimes the loose comments made by them, she is exposed to earlier also she is exposed to sexual behavior or sexual intercourse, and so many of the loose talks which the doctor speaks, or anybody, any person who is there. So all such things should be avoided. These are all certain etiquettes also should be observed by the examining doctor, which is extremely important. to save the dignity of the girl or the woman.
Gauri ma'am.
Yeah, I would just like to add two things to Dr. Varsha. She has covered this so completely and so well, so that examination is almost all complete. Just 2 points. That is, one thing is that if the patient, most of the times, rape victims, I mean, they do not get justice because we do not have enough evidence. The biggest excuse in our country is no punishment because of lack of evidence. And the first point of evidence is doctors, and most of the times sometimes it is in a private setup. So that is something that if we are good in and we are educated and we know what we have to do and we have to collect, I think we will be doing a big major responsibility as far as collecting evidence is concerned. Secondly is that many times it is possible that the girl or the boy has come to us after a certain period, after the incidents has occurred. But as Dr. Varsha has said, and even the report has said, that you have to mention that after how long you are examining, and that is also important. So even if it has been a while after those incidences occurred, we should not defer the patient ki abhi itne din ho gaye, why do you want me to examine you? I think we should be like diligent in our complete protocol of examination, treatment, counseling, and support to the person whoever is under purview. Thank you.
Yeah, Gauri has rightly said, I have expert witnessed almost more than 500 cases. And one I remember, most of the time, the questions asked to the expert is, Madam, hymen rupture ho gaya hai, kya ho gaya? वो हार्मोन कैसे रप्चर हुआ? तो इट्स लाइक invalid question they ask, like झाड़ से ऊपर, if she falls from the tree, she bicycle, hymen rupture होगा क्या? So what I do is, whenever I write a report, I write there completely after complete physical examination, local and general examination, as well as the history, I come to the conclusion that there was a forceful or whatever intercourse happened. So I write complete opinion of mine, so that there won't be any objectionable thing which comes. So what I need to tell you is the complete opinion has to be put on the paper, so that there won't be any query, and the accused will not scot free.
The newer guidelines have been given just
No
last.
two-finger test.
Yeah, newer guidelines for examination of the rape victim, all in detail, especially after this Nirbhaya case. So much of discussions and so much of these certain things have been removed and certain things have been added. So all newer guidelines have been given in 2022.
Thank you for the great discussion and great inputs by all. We will move on to the most important aspect, that is MTP under 18. Yes. I invite Dr. Girish Mane sir. Yes, sir. Girish Mane sir.
Yes, sir.
Yeah. Please give your expert comments on MTP under 18.
Yes, regarding the MTP in the girls, and especially if the girl is below 18 years of age, there are many myths, not only with the patients or the doctors, I mean general practitioners or the doctors from the other pathways, but to the media people, the people from police department even, and many people, that people think that nobody, even the doctors cannot do MTP below 18 years of age. This is one of the very big myths, because many times some people, they are coming to me. For example, I come across one media person. He came in my hospital, he sit in front of me, and just like a dada, he was sitting in front of me, and he said, sir, मुझे पता चला है कि आपने एक लड़की का MTP किया. मतलब he was just trying to molest कि भाई इससे कुछ मुझे मिल सकता है. मैं बोला हाँ किया भाई, क्यों, कुछ प्रॉब्लम? So he said me कि सर लड़की का तो abortion नहीं कर सकते. It means it is one of the example that many people, they think that the MTP cannot be done below 18 years of the age, and everybody knows that absolutely every girl or every lady, they are liable for MTP provided they are fulfilling other criteria. Number one. Number two, there are some myths regarding the consents. And as you know that if any girl or any lady who is above 18 years of age can give the consent for MTP, and if she is undergoing for any surgical procedure, then usually you should take consent of any companion. And if any girl, she is below 18 years of the age, then the consent of the guardian or the parent is must definitely you should even take the consent of that girl also. Then many times the patients, they are not even ready to inform the police because they are not aware of the facts or regarding the POXO. So it is your duty to inform before proceeding for the MTP. Then many times many doctors, they says that I will not do MTP in such cases. But mind well, whenever you are coming across regarding the pregnancy of that lady, even though you are not doing the MTP, you have an obligation of POXO Act and you have to do all the proceedings what POXO Act has mentioned. Then sometimes the doctors, they are coming across and they're saying whenever I am asking them, sir, have you informed the police? They said, no, I have not informed because I have not done the MTP. So again, this is a very big myth in the amongst the obstetrician that when I have not done MTP, then I am not supposed to inform to the police. Again, this is a very wrong thing. And here comes the role of POXO. That is the next slide, sir. That is the Protection of Children from the Sexual Offense Act 2012 and now just amended in the 2019. Friends, this is a very important act. There are many aspects of this POXO Act. For example, if you are not doing MTP, then there is no worries and you are not to bother about the MTP. If you are not doing X-rays, sorry, sonography, then there is no issue if you are not knowing about the laws regarding the sonography. But only because you are an obstetrician and you are coming across such cases indirectly, because many doctors, not many doctors, almost every doctor have delivered at least one patient in their whole lifetime who was married, but she was below 18 years of the age. And what POXO Act says, POXO Act says that whenever you are having an apprehension or a knowledge of involvement of any boy or a girl who is below 18 years of the age in any kind of sexual activity or sexual harassment, you have to inform to the appropriate authority, that is the SJPU, that is the Special Juvenile Police Unit, or CWC authority or other authority. You have to inform. And that's why age determination is the main factor, and it's not a responsibility of the patient or a court or the police, but it is the responsibility of the RMB, because whenever such cases they are going in the court of law, it is your duty to prove that that boy or that girl, especially, let's talk about the girl because MTP happens in them only. So it is your duty to prove that she was above 18 years of the age. And these are some ways how you can prove the age, or how you can have some that you can definitely say that she was above 18 years of age. Either you can demand for birth certificate or school living certificate or Aadhaar card or driving license or election card. And if nothing is there, then you can go for clinical examination, dental examination, or radiological examination. Now you will say, are these examinations, they are very important. Yes, if you have done such kind of clinical examination and if you have some evidence that it is proving that she might be above 18 years of the age, then at least that paper can save you from the court of law. Now there are two kinds of patient in your OPD. They can be there. For example, if sometimes the patients, they are ready to follow the POXO Act and they are ready to give you consent to inform to the police, then in such cases what you have to do, you have to take some proof from that girl that she is below 18 years of the age, then do the definite diagnosis of her pregnancy, then calculate the gestational age, then you can undergo the expected or whatever other investigations you want to do, for example the CBC, the sonography and all, then determine the method of MTP, and then you have to inform to the police. There are some ways to inform to the police. For example, you can either inform by giving the written paper, the FIR should be in 2 copies, send somebody to the police department, mention everything in that FIR, inward 1 copy to the police and take 1 copy with you and try to preserve these copies forever with you. And sometimes what happens, the police, they are not ready to accept your FIR. In such cases, either you can send an email, then you can dial 100, then you can inform the higher authorities, you can inform the CWC, that is Child Welfare Committee, you can inform. And if not possible, then you should dial 1098. This is the best and convenient method. And sometimes even you can inform on the telephone and just do the video recording of that. Okay. Then what happens if you are not informed to the police? If you are not informing to the police about this case, then you can face the problem in the form of the imprisonment, and sometimes imprisonment with the fine also. Means if you are failing to inform to the police, you'll have to do 1 more house post, but without stipend. Here you are supposed to pay the stipend to the police department, correct? Then if your patient is not ready, that you should not, and if she is not ready to inform to the police, then in such cases, even if your patient is going out of your hospital, you are not in FDP, you are having an obligation to inform to the police, and you have to inform to the police. So whenever patient is coming to you, first counsel the patient that even you are ready or not ready, I have to inform to the police. Whether you are ready for MTP or not ready, I have to inform to the police, and that and this is your duty. And so according to the POCSO Act, the important lessons for today, that any person, not only the doctor and not only the obstetrician, the pediatrician, the surgeon, the pathologist, the sonologist, even the general practitioner, the teachers, the hotel people, the media people, even the parents or any person who is above 18 years of the age, and if they are having the knowledge or apprehension of any child in any kind of sexual activity, then they are obliged to inform to the police or the special juvenile police unit. Now you have informed to the police, and you have now further what you should do for the MTP, then proceed for the MTP. Now very important aspects regarding the MTP. Don't go for the MTP with the MTP pills, because if you are giving the MTP pills, then you will never get any specimen for the further proceedings. So you have to go for the methods of MTP where you can preserve that POCs, and preserve these POCs in the normal saline, preserve with these all POCs with you for 72 hours. And as soon as you are doing the MTP, send another letter to the police department. Actually, these things are not written in the books, but by experience, I'm telling you, you have to inform to the police, and you have to ask them to collect the product of conception within 72 hours. Then now the obligation is on the part of police to collect the POCs for the evidence, correct? And if the police department is not taking the cognizance of your information, and if they are not collecting the sample, then you can dispose of these POCs after 72 hours. For example, if you are giving MTP tablets to the patient, or if you are not informing the police to collect the sample, or if you are discarding the whole sample, then again you can have another case for breaching the case of destruction of the evidence. Mind it well. And there is no need to take the permission of police for the MTP. The only obligation on your part is just to inform the police that such and such patient of this and this age from this and this place, she has been to your hospital and she is pregnant. It means she is involved in the sexual activity. So friends, my take home is, treat as the save the girl, but save your skin first. There are so many of the record tips. I have already told you almost everything. The only important thing is you should ask for some or the other kind of age evidence to every person, either she is married or unmarried, who is below 18 years of the age, number one. Number two, whoever is coming to your hospital, whether married or unmarried, whether very close to you, even if the patient is your close relative and she is below 18 years of the age, or else her conceptional age at the time of that conception, if she is below 18 years of the age, even at the time of conception, she was 17 years and 364 days. It is your duty to inform to the police, and if you are failing to do that, then you are liable for the punishment, either 6 months imprisonment or the fine, or both the things. So friends, take the POCSO Act very seriously, because there was one time when we never took the PCPIDT Act very seriously, and when the authorities, they came to know regarding the PCPIDT Act, and the havoc happened, and many of our friends, they were behind the bar. So my last take home is, whenever patient is coming to your hospital, first think medico-legally and not ethically. You should think first medico-legally, then medically, then think technically, and then comes empathy and whatever you are saying. I suggest everyone to work with honesty. Definitely, you should work with honesty and sincerity, but don't get that honesty or sincerity in your head. Consider yourself just as other professions, because now we are liable for the consumer forum and all the laws applicable to all other professions, isn't it? Because we don't have any extra privilege in our country. In fact, we are more vulnerable than any other profession. And don't get yourself fooled with the terminologies like noble profession, lifesaver, God, and this and that. Definitely, you should care your patient. You should respect your patient. You should work with the dignity. You should work with sincerity. You should work with the honesty. But always one side everything and one side law. You have to keep it in mind, because जब आप कोर्ट की steps चढ़ोगे, whenever you are in the court of law, only you and only you and your luck are with you, and nobody will come in along with you to save yourself. And mind it well that to come to this position, you have to sacrifice a lot of things. And so the last thing, this is the only life we are getting. You cannot continue your doctorship in another life. Thank you very much.
Thank you, Girish sir.
Yes,
Such
he
an
needs a
elaborate-
big round of applause. Thank you very much, Dr. Girish Mane, for the wonderful input and straightforward practical tips.
Thank you, ma'am.
We're all thankful to you.
Sudesh sir, would you like to comment?
Okay, sorry, I had to be in the middle. But Dr. Girish has very aptly covered almost everything. But I do practice in an area which is a rural area, and seeing a patient in the OPD who is a primary gravida and who is less than 18 is a common scenario in my OPD. Now, if by law I go and send every patient who I see less than 18 who is married and just come to me for ANC, if I start complaining to the police department will know no other work than looking at my cases. So we have to find a way out. I do ask some of the age proof, most of them don't have. Then we have to write it so that the date of conception comes more than 18. That's the only way out. This is off the record tip, but that is what to do. Because otherwise the patients will start quarreling with me and every day would be halla gulla in my hospital that I am to you to show my patient for ANC and you are showing us the way of police station.
Right now, the solution
Sir, you have to balance it
by
between
the
the law
government
and
has
your
given that
own
you have to.
practice.
Yeah.
You have to balance the
no.
law and your own practice. See,
You need to register your cases into the register, which those who are delivered before 18 years of age, right? 21.
Yeah.
no, Varsha.
So you have to, no, you
Not
keep
only
a
register, you
record.
have to inform to the police. No,
I agree, but it is so difficult.
Even if it is difficult, for example, if I am putting one complaint against Sudesh sir or you, the police will arrest you within 10 minutes. Then it is impossible to prove that you are not breached the POCSO Act. So my take home is only, see, instead of mentioning the age of that patient as 18, the only safest way or the in-between way, this is off the record again. You can only ask your patient to write down the indoor paper, whatever paper you are providing to them, ask her to write her name in her own language and ask her to write down her age as 19 or 19 and a half. At least that's much evidence with you that, sir, she has only told me her age 19 and plus 19.5, because there is one loophole in the law that never in no POCSO Act, never in the MPPA or PCPNDT Act, it is said that you have to ask for the age proof. It is your aspect. The law never asks you to ask for an age proof. So we can say that, sir, it is not mandatory on my part to get any legal or valid age proof. And she has told me the age 19 years and that's what I have done and I have not informed to the police. But you cannot say that most of my patients, they are below 18 years of the age and that will cause a mess in my hospital. Again, I would say that when the problems comes to you, these things remain in the webinar only, and you cannot say anything to the judge. So mind it well, when the authority will be well aware of POCSO Act, that can be a problem to everyone. So at least try to find out some another ways. Actually, the negotiations are going on with the government of India or with the law by the FOXI regarding the age only. And we are asking them to make this POCSO Act for 16 plus age. Let's see, but till today, at least we are having an obligation to inform the police. That's all. No more things about it.
Sir, sir, one question.
Yes, please.
Sir, regarding those coming for the sonographies or those coming in the OPDs, that time we cannot ask the patient to write her own age. That time we may be held in, we may get held up in a trap or something. Right?
No. See, you have 2-3 simple things. Number one, the patient is coming to a OPD, that it is not a proof that you are aware of her pregnancy unless and until there is a valid proof of her pregnancy after your examination, then and then only you'll be coming across. For example, if a girl is coming to my hospital, now I'll tell you some good ideas. For example, if a girl is coming to my hospital, she is below 18 years of the age, and anyhow I came across that she is having like pregnancy, but very early pregnancy. What I can do, if they are not ready and if I want to escape myself from informing to the police, then I'll write down her name, her age, even 16 years of the age, her address, everything, complaints of pain in abdomen, falana, bistana, whatever I'll write, and I'll write advice sonography, and I'll send her with that paper. That's all. Because now I am not aware that she is pregnant, so I am not having any obligation to inform to the police, correct? And I'll ask that girl, for example, I'll pretend that, and I can pretend that I'm not aware of her pregnancy. That's it.
Does the sonologist has an obligation to inform the police?
Exactly,
Is it only the gynecologist?
Exactly, because I was having only complaint of pain in abdomen. It doesn't prove any pregnancy. And second thing, whenever you are giving any prescription later for or referral later for sonography to the girl, don't write as a probable diagnosis of pregnancy. It proves that you were aware about the pregnancy. Just write down pain in abdomen or lump in abdomen and USG abdomen pelvis. That's all. Because sometimes what happens, the girl, she will run away after doing that sonography with the referral, the name of the referral doctor as Dr. Varsha Lahade. Correct? It means that Dr. Varsha Lahade was aware somewhere. So just write down the name of that girl, the referring doctor, the name of that girl, address, age, write down the correct age and just write down the probable diagnosis, pain in abdomen or advised USG abdomen pelvis and just sign it out. If that girl is coming to you, even she's your relative, please inform to the police. Please inform to the police because that is only the way out. And once the thing happens, and you have to inform within 24 hours, mind it well, because there are so many doctors they are facing so many problems regarding the POXO. In fact, I know more than 50 doctors right now who are facing these problems. The negotiations are going on, the things are going on in the court of law, but now there is nothing left in the hand of the doctor or the person they are hiring for their defense. Nothing is there because the only way out is inform the police either or prove that you have some valid reason that she was above 18 years of age. Only two things. That's all.
Okay.
Thank you, sir. Thank you.
Yeah,
Thank you,
thank you.
sir.
We will move on to the details of POXO by Sudhir Doshi, sir. Yes, sir. Are you there, sir? Sudesh, sir?
Yeah, I'm
Yes,
there.
please.
Well, about POXO, as all learned people, most of us have gone through it. This is just a revision about it. Few salient features which I would like to emphasize. The thing is, child means any person below the age of 18 years. So this is a unisexual. It is not that the POXO is applicable only to girls. It's applicable to boys also. Then there are the offense have been described in reality, penetrative sexual assault, which means there is penetration of penis to any extent into vagina, mouth, urethra, anus of the child, or make the child to do so with him or any other person. So this has been substantially described because previously, as we used to see in Hindi movies, whether it was a penetrative sexual assault, then only it would become rape. If there was no penetration, then it will become a rape. And all these fallacies have gone. And so penetrative sexual assault has been defined. And other things like sexual harassment, sexual assault have been described. And they have described to great extent that any person who does any kind of sexual assault would not escape it. Next, please, Madan. These are the various definitions, and where oral anal sex, urethral sex, all have been described and all are under the punishment. So what is most important of all these things is, though many times a punishment have been described for such offences, not less than 7 years, may go for imprisonment to life, and shall be liable fine, and other things are also there. But I would like to come, if you can scroll to section 19, which is most important part for all of us. Mother?
Yes.
Hello. Can you scroll down to section 19?
Okay.
And this sexual assault, also penetration sexual assault, have said repeated sexual. So whenever person social responsibility, like he's a doctor or he's in charge of a school or he's in charge of a hostel or he's in charge of a institute or maybe government doctor, then his responsibility is more. So if he is involved in such cases, then his punishment will be more. Now, what is the important part is section 19, which Dr. Girish has said in detail, that procedure of investigation. Anyone, including the child, may report even apprehension of offense to special police unit or the local police and be given an entry number and recording right. What is the important part is, if you have even apprehension of the offense, and what would the offense, when a person less than 18 comes to you as a gynecologist and you see that she's pregnant, that means a penetrative sexual assault has been performed. And even if you think that she's pregnant, they're not sure liable to inform. So, when our many times maybe come over there that we inform the police and the police will do the rest of things, whatever to do. So information is very necessary. We have to inform we have come across such case where there has been a sexual assault on the patient and she's pregnant. And next, please. And the report within 24 hours, so child welfare community. No, come back. And no civil or criminal liability to a person for giving information in good faith. For example, if you give information of some person in good faith and for some other reason it will be wrong, then there will be no civil or criminal liability of you. However, information intends to harm relation of any person or victimize a child is punishable under section 22. Secondly, in section 20 also given that the police are also bound to take the cognizance of such information. If the police, they fail to take such cognizance of such information, then there is punishment for the police also. So whenever you inform the police and police does not action on it, then the police are also liable for prosecution. Also, the details are given for procedure for media. No reporting in media relating to the information which may the reputation of the child disclose her identity. Punishment is imprisonment for 1 year or fine. Media has a responsibility not to disclose the name of the child. Recording of statement should be done in the police station and all other things. These are legal proceedings which we may not have to indulge in details, but most important part is section 19 and section 20. Thank you, Mother. I think I should wind up. We are getting a little late.
Okay.
And one more important thing, it is not related to the pregnancy only.
Yes. Any sexual assault, even
person is having the pornography.
These points are all very important. Child not to be kept in police station at night.
POCSO Act. So involvement in sexual activity in any form by any person, they are punishable under POCSO Act. Over to you, Madan sir.
Yes. I think this we have covered medical examination of victim.
Yes. Practical aspects we have covered. We can skip all these slides.
Yes. Last part.
Make it forward.
Dr. T.S.S. Rao, sir. Last issue to be discussed is the psychological consequences of the sexual assault. Mostly we have covered, but just highlight in short.
The important point is immediate reactions, what we feel. In fact, documented, they are called as stress-related symptomatologies.
Yes.
Long-term consequences. See, many of the times, in fact, as we are trying to talk about child sexual abuse, some of these things are carried forward for pretty length of time, and all through the life, these ideas may be present. I still remember one lady immediately after marriage, about a month later, there was some quarrel and one hit near the neck. And 20 years later, she was talking about pain in that particular area. So these are all straight away indicate that certain types of pains are, in fact, some unexpected things are remembered, re-remembered, and that way they get stuck in the memory for a long time and carried forward. Those things, say, for example, intimate partner violence and some of those type of things we talk about, the extent of problems, what they produce, and the sexual abuse and related things, the type of effect they produce, there will be quite a bit of difference. And earlier the age, vulnerable population, the support that is available, personality and other related aspects, each of these type of things actually matter, and ultimately how it works out to be. In fact, one of the things one should remember. So one immediate, this thing is actually anxiety, what we call expecting something unusual will happen, or all the other related aspects related to that. the depression, the individual feeling really terrible, and in fact, the range of biological changes and all those type of things that can come, and ultimately, people talking in terms of suicide and other related problems. That is one, leading to drug abuse and other related areas. The range of neurological symptoms and other related things actually one may go through. That means the type of problems is psychological, what they can present could be varied and multiple, and one has to sit and spend some time to get all the information that is necessary. As actually documented already here, the shame or guilt. See, just like what we talk about so many aspects, something injury to the body, mind, or in fact something the connotation related to the sexual, these memories are carried forward in a very big way, and whole range of issues that actually crop up. Where the terminology what we used as post-traumatic stress disorder. That means the hyperarousal, revisit and reliving certain symptoms and signs, and all the time constantly preoccupied with that, something extremely common. As you have already mentioned, embarrassment, fear, distress, sadness, vulnerability, social isolation and withdrawal. In fact, people carrying forward to a significant degree, problems of sleeping, eating disorders, flashback and nightmares, depression and suicidal thoughts. That means the very type of symptomatology actually what they can present. What one has to remember is actually how best to recognize it as early as possible, keeping in mind that these type of things are possible in one individual's life, and psychological support being provided. That means one of the points repeatedly mentioned earlier was that empathetic approach, the capacity to establish proper rapport with the individual, looking into, in fact, the providing confidence, not being judgmental, and all of this type of things actually one actually should be having in mind. So in general, what I can say is actually psychological problems are extremely common, and one should be well aware of recognizing it properly and properly, adequately attending to it. Giving just a medicine is not a problem which is going to solve depression and things like that. Here, in fact, people have emphasized about range of psychotherapeutic techniques, the behavior techniques like cognitive behavior therapy and such other things are really useful to remove the anxiety, sensitivity, and misconceptions actually what they be carrying forward.
The other things which can be included in this, the effect on the partner. If a married woman is raped, and the effect on the partner, how the sexual rehabilitation, because being a sexual sexologists or the issues with the sexual aspects, so how they can be rehabilitated. In the sexual rehabilitation is extremely important. If an unmarried girl is raped, and the consequences, fear to get married, and again after marriage, so much of not believing anybody, not believing the partner, non-consummated marriages. And in the same way, a married woman, so many times she refuses to be with him, and all the guilt feelings. So this, apart from all the other rehabilitations of the sexual assault or the rape, the sexual rehabilitation and the partner counseling and the counseling of the whole family is also extremely important in such cases.
Of course, very well taken, and this is one of the area often neglected, and this is one which actually colors the relationship to a great extent. Well, but something really happened in out of context, and here the two people suffering constantly and continuously. What individual is going through and what the partner will go through, one should almost always be very clear about what actually. In history taking and examination, we also have to be a little careful in the sense that asking some of those things in presence of however close and however friendly and however well-adjusted they are, we must talk to each one of them separately and with the consent only. In fact, the issue should be brought. In fact, this is one of the other areas. In fact, some people we are very close, we don't mind talking about it, but it can create quite a bit of difficulties. Once this information becomes open and apparent, the reaction of the partner and the family sometimes changes significantly drastically. So we should keep it in mind the range of aspects. One is socio-cultural, religious, family-related issues. So these are all important things in evaluation and management.
Yes. So
Very
when
well.
you take history separately, you are correct, because so many times husband will not be aware of the sexual assault on the wife in the office or with the boss or some of the colleagues. She will have undergone and develops severe sexual dysfunction, not cooperating with him, and he will be wondering why she is depressed and why she is not interested. So when you take history separately, those that history will come out. And
When
so
one-
many cases of non-consummated marriages. I had one patient who called all men are dogs, she said. Why are you not having? Because she was raped by the father, uncle, and the earlier person who was going to get married. And one sympathetic boy married her and then gave life, knowing her history also. But still, she was unable to cope with him also. So that was the thing which was working in her mind.
Many of the times when husband and wife two are there and handling the problem is much more easier than once this relatives get into the picture,
Yeah.
Issue becomes very complicated.
They spoil the whole issue, the whole relationship. Disturbed interpersonal relationship is one way of presenting such deep-seated guilt feelings also. So I must congratulate Dr. Madan Kamble for selecting the selection of topics and the beautiful slides, beautiful information, and all the panelists giving such wonderful inputs. And really, it is a learning experience for me also and for everyone also.
Yeah,
Thank you very much for the opportunity.
Even I would like to take
Mysore, but I am also placing my sincere thanks. A wonderful opportunity.
Even I would like to
Madan
take
sir,
this
thank you very
opportunity
Yeah.
that
Usha, continue.
Dr. Madan has conglomerated AMOGS and Foxy together, as well as he has handled a very
difficult topic.
No. He has handled a sensitive topic of making Maharashtra and Karnataka together on the one platform. I congratulate him for that.
Actually, thank you all.
It's a social issue.
So one big clap to him.
Yes. Thank you, Girish.
Yeah, accept the trophy and congratulations and thanks all the esteemed speakers.
Would like to have one physically.
Yes, definitely.
Actually, I feel honored to have you all on this platform. So many great experts throughout the India, so many seniors, and thanks for the great inputs you have put in this subject. Actually, it's a very big. It looks small, but it's a very big topic.
Yes,
it
It's
requires
not small, very vast topic, very vast, and you have put it in such a nutshell in such a good way.
Madan sir, I would say we can have a 3 days conference on abuse.
Yes, it's a very big topic.
Honestly.
They've condensed it so well.
Yeah, we should thank to the
Thank you again.
Thank you very much.
The educational
It's my duty to say a vote of thanks.
Before vote of thanks.
Yes, sir.
Phone call a few minutes back from Apurva Datta that February 16th, he requested me to speak on history taking and approaches to the management of sexual problems.
Okay.
A wonderful opportunity given to me. I'm really hopeful it will work out.
Yeah,
that's wonderful.
Yeah, it will work out. I am sure.
I would like to mention the thanks to AMOGS office bearers, Foxy office bearers, and my co-conveners, Chief Guest Dr. Jaideep Tank sir, Pardeshi sir, Sharma sir, and all the esteemed faculties, Padmini Prasad ma'am, Gauri ma'am, Varsha ma'am, Priyanku Roy, Dr. Girish sir, Dr. T.S.S. Rao sir, Dr. Kiran Mai madam, and Dr. Sudesh Doshi sir for accepting my invitation and making it a great success. And also I would like to thank Zydus Gynext for providing this platform. Yes, thank you once again all, and
productive.
Yes.
Shall
we
you.
end the meeting?
Thank you so
Good
much.
night to you all. Thank you.
Thank you so much.
Thank you.
Thank you very much.
Thank
Good
you
night,
all.
everyone.
Bye-bye.
Bye. See you and take care from OXO.
Yeah. Yes.
Yes.
Sure.
Thank you.
Thank you. Thank you, everyone.
Thank you. Thank you all.
सुयोगा काहीतरी बोल, तुझा फोटो घ्यायचा आहे.
सर तुमचा टॉक खूप छान होता.
कॅमेरा का बरं बंद केला?
बंद नाहीये.
मी अमरावतीलाच आहे.
अरे मग आपण एकत्र